42 million Indians have thyroid disease. According to projections from studies across India, approximately 42 million people in India suffer from thyroid diseases, making it one of the most widespread endocrine conditions in the country. And here is the most alarming part. Nearly one-third of patients with hypothyroidism across all age groups in India remain completely undiagnosed and untreated. They are walking around with a failing thyroid, gaining weight they cannot explain, losing hair they cannot stop, feeling exhausted they cannot fix, and being told it is just stress. Linos, it is not stress. Today I am going to show you the 10 most important warning signs that your thyroid may be silently failing, and the exact test you need to ask for today. If you are a woman watching this, please pay very close attention. This video could explain years of symptoms you have never been able to understand. Welcome to MediVista, Health Explained Simply. I am a postgraduate medical professional, and every video on this channel gives you accurate, evidence-based medical knowledge in simple language. Before we get into the 10 warning signs, let me quickly explain what the thyroid gland is and why it controls so much of how you feel every single day. Warning sign number 1, unexplained weight gain, especially around the abdomen, despite no significant change in diet or activity. This is the symptom that brings most thyroid patients to their doctor, but tragically, it is often dismissed as overeating or lack of exercise for years before the thyroid is investigated. Here is the mechanism. Your thyroid hormones regulate your basal metabolic rate, the number of calories your body burns at complete rest. When thyroid hormone levels drop, your metabolic rate slows dramatically. Your body burns fewer calories. Fat accumulates, particularly around the abdomen, hips, and face. And no matter how carefully you eat or how much you exercise, the weight does not shift. Hypothyroidism has been directly associated with dyslipidemia and weight gain, which exacerbates glycemic control and insulin resistance, creating a dangerous metabolic spiral. If you have been gaining weight steadily despite genuine dietary effort, please ask your doctor for a thyroid function test. You may have been dieting against an underactive thyroid for years. Warning sign number 2, a deep, persistent fatigue that sleep does not fix. This is different from ordinary tiredness. Thyroid-related fatigue is overwhelming and constant. You wake up in the morning already exhausted, and drag yourself through the day with no reserve energy. Every cell in your body requires thyroid hormone to generate energy through the mitochondria. When T3 levels drop, mitochondrial function slows, and every tissue in your body, including your muscles, becomes energy-starved. The result is profound physical weakness. Simple activities become exhausting. Climbing stairs, carrying shopping, getting out of a chair. Clinical studies of hypothyroid patients confirm that slow movement is among the most common signs, reflecting the deep physical slowing that accompanies thyroid hormone deficiency. If you have described your fatigue to multiple doctors and been told everything is normal, insist on a full thyroid panel including TSH, free T3 and free T4. This single test could explain everything. Warning sign number 3, significant hair loss and brittle nails. Thyroid hormones play a critical role in the hair growth cycle, specifically in maintaining hair follicles in the active anagen growth phase. When thyroid hormone drops, follicles shift prematurely into the telogen shedding phase, causing diffuse hair thinning and shedding across the entire scalp. This is not the patchy hair loss of alopecia areata. Thyroid-related hair loss is diffuse, affecting the entire scalp, and often also affects the outer third of the eyebrows, a finding that is highly specific to hypothyroidism. If you are losing the outer portion of your eyebrows, this is a classic clinical sign that your doctor is specifically trained to look for. Nails in hypothyroidism become thin, brittle, slow-growing, and may develop ridges or become concave. Millions of Indian women spend thousands of rupees on hair treatments, oils, and supplements without ever checking their thyroid. A TSH test costs less than 200 Indian rupees. Warning sign number 4, feeling cold all the time, even when others around you feel comfortable or warm. Your thyroid hormones regulate thermogenesis, your body's internal heat production. When thyroid hormone drops, your body generates less heat. Hypothyroid patients frequently report feeling cold when others are warm. Cold hands and feet even in summer. Needing extra blankets. Being uncomfortable in air-conditioned environments that everyone else finds pleasant. In India, where summer temperatures routinely exceed 35 to 40 degrees Celsius, feeling persistently cold is a particularly striking and specific symptom. Pay attention if family members or colleagues comment that you always seem cold. And pay attention if you find yourself reaching for a shawl or sweater in conditions where others are completely comfortable. This is your thyroid speaking. Warning sign number 5, persistent depression, low mood, and brain fog. This connection is one of the most important and most misunderstood aspects of thyroid disease, and it causes enormous suffering when thyroid-driven depression is treated with antidepressants alone without ever investigating the thyroid. Thyroid hormones directly regulate serotonin and dopamine production and receptor sensitivity in the brain. When T3 drops, serotonin signaling is impaired, and depression follows. The brain fog of hypothyroidism is distinctive: poor short-term memory, difficulty finding words, mental slowness, difficulty concentrating, and a general sense of cognitive dulling, described by patients as thinking through thick fog. Decreased thyroid hormone levels in hypothyroidism impair glucose uptake and energy metabolism in the brain, directly contributing to cognitive slowing and mood disruption through metabolic mechanisms. Every patient presenting with depression, particularly women, should have thyroid function tested before or alongside starting antidepressant therapy. Treating hypothyroid depression with antidepressants alone is like treating a vitamin D deficiency with painkillers. Warning sign number 6, persistent constipation. Your gut motility, the muscular contractions that move food through your intestines, is directly regulated by thyroid hormone. When thyroid hormone drops, intestinal muscle contractions slow dramatically. Food moves through the gut far more slowly than normal. The result is persistent constipation, often accompanied by bloating, abdominal heaviness, and discomfort. This type of constipation does not respond well to dietary changes or laxatives alone, because the underlying cause is hormonal, not dietary. Many patients have been prescribed laxatives, fiber supplements, and probiotics for years, when the true cause was an undiagnosed underactive thyroid. If you have chronic constipation that does not respond to normal measures, especially alongside other symptoms on this list, please investigate your thyroid. Warning sign number 7, very dry skin and puffiness of the face and eyes. Coarse skin is among the most common signs of hypothyroidism confirmed in clinical studies, reflecting the profound effect of thyroid hormone deficiency on skin cell turnover and hydration. Thyroid hormones regulate sweat gland function and skin cell renewal. When they drop, sweating decreases and skin becomes dry, rough, and coarse. Normal moisturizers provide only temporary and incomplete relief. A more specific finding is myxedema, a non-pitting puffiness of the face, particularly around the eyes and cheeks, caused by accumulation of glycosaminoglycans under the skin. This facial puffiness is different from normal fluid retention. It does not leave an indentation when pressed. It gives the face a bloated, rounded, almost unrecognizable appearance, and it is one of the classic clinical signs of severe hypothyroidism. If people have commented that your face looks different, puffier, or if you notice morning puffiness around your eyes that persists throughout the day, please investigate your thyroid. Warning sign number 8, irregular menstrual periods and difficulty conceiving. Thyroid hormone has a significant effect on women's lives, and thyroid dysfunction is widespread, particularly among women, with the thyroid disease epidemic appearing to affect Indian women more than any other ailment. Thyroid hormones are intricately linked to the female reproductive axis. Hypothyroidism disrupts the hypothalamic pituitary ovarian axis, causing irregular or absent periods, excessively heavy menstrual bleeding, painful periods, and in severe cases, complete cessation of menstruation. Perhaps most critically, undiagnosed hypothyroidism is one of the most common and most treatable causes of female infertility and recurrent miscarriage. Every woman struggling to conceive, or experiencing recurrent pregnancy loss, must have a full thyroid panel as part of her fertility investigation. A simple, inexpensive test, and completely treatable when found. In India, where infertility carries enormous social and emotional burden, missing a thyroid cause is a tragedy that is entirely preventable. Warning sign number 9, high cholesterol that does not respond to dietary changes. This connection surprises most people, but the relationship between thyroid and cholesterol is direct and well established. Thyroid hormones regulate the expression of LDL receptors on liver cells. These receptors clear LDL bad cholesterol from the blood. When thyroid hormone drops, LDL receptor expression falls, LDL accumulates in the blood, and cholesterol rises. Decreased thyroid hormone levels in hypothyroidism lead to dyslipidemia through impaired lipid metabolism, directly raising LDL cholesterol and triglycerides. This is why I always recommend, if a patient has newly discovered high cholesterol, especially a woman, always check the thyroid before starting statin therapy. Treating hypothyroid-driven high cholesterol with statins without correcting the thyroid is treating the consequence rather than the cause. If your cholesterol has risen despite dietary changes, get your TSH checked today. Warning sign number 10, slow heart rate and generalized fluid retention. Thyroid hormones directly stimulate heart rate and cardiac output. When they drop, the heart beats more slowly, a condition called bradycardia. You may notice your resting heart rate is consistently below 60 beats per minute. You may feel a sluggish, heavy heartbeat. In severe hypothyroidism, the heart muscle itself becomes weakened. Studies of cardiac patients in India have confirmed that thyroid dysfunction, both hypothyroidism and subclinical hypothyroidism, directly causes adverse cardiovascular events and cardiac derangement, making thyroid screening essential in all cardiac patients. Generalized fluid retention is also common, causing swelling of the hands, feet, and face. This is different from cardiac or kidney-related edema. It is caused by the accumulation of mucopolysaccharides in tissues when thyroid hormone is absent. If you notice persistent puffiness and a slow pulse, please see a doctor urgently for a full cardiac and thyroid evaluation.